Question 1. What is the term for a stimulus that, when presented immediately following a behavior, increases the future likelihood of that behavior? A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer: C. Positive reinforcement. This question asks for the definition of positive reinforcement, which is a core concept in ABA. The keyword increases the future likelihood tells you it's reinforcement, meaning the behavior is getting stronger or happening more often. The phrase, when presented immediately following a behavior, means something is being added or given. When you add something positive after a behavior and the behavior increases, reinforcement, that's positive reinforcement. Think of giving a child a sticker immediately after they clean up their toys, and they start cleaning up more often. Positive reinforcement is adding something to make the behavior happen more. Question 2. In the ABC model of understanding behavior, what does the A stand for? A. Action. B. Analysis. C. Antecedent. D. Association. Answer: C. Antecedent. This is a fundamental question about the three-term contingency in ABA. The ABC model is a way to understand why behaviors happen by looking at what comes before and what comes after the behavior. A stands for antecedent, which is anything that happens immediately before the behavior occurs. B is the behavior itself, and C is the consequence, what happens immediately after the behavior. Understanding the ABCs helps us figure out the function, purpose, of a behavior. Remember, A comes first in the alphabet and in the ABCs of behavior. Question 3. What is the definition of frequency measurement? A. Recording how long a behavior lasts. B. Recording the time between the start of a stimulus and the start of a behavior. C. Counting the number of times a behavior occurs. D. Recording how much time passes between two occurrences of the same behavior. Answer: C. Counting the number of times a behavior occurs. This question asks for the definition of frequency, a basic type of continuous measurement. Frequency is simply a tally or count of how many times a specific behavior happens within a designated observation period. Option A describes duration. Option B describes latency. Option D describes interresponse time, IRT. Frequency is used for behaviors that have a clear beginning and end and don't happen constantly. Just count each time you see the behavior happen. That's frequency. Question 4. Which ethical guideline requires RBTs to protect the privacy of their clients? A. Integrity. B. Professional boundaries. C. Confidentiality. D. Responsibility. Answer: C. Confidentiality. This question asks about a core ethical principle in ABA related to client information. Confidentiality means keeping all sensitive information about your client private and only sharing it with authorized individuals who have a need to know for treatment purposes. Integrity, A, is about honesty. Professional boundaries, B, are about maintaining a professional relationship and avoiding dual relationships. Responsibility, D, is about fulfilling your duties. Protecting client privacy is the definition of confidentiality. Keep client information secret unless you are allowed to share it. Question 5. What is the term for a consequence that, when removed immediately following a behavior, increases the future likelihood of that behavior? A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer: D. Negative reinforcement. This question asks for the definition of negative reinforcement. Reinforcement means the behavior increases, and negative means something is taken away or removed. So, negative reinforcement is when a behavior becomes more likely in the future because it results in the removal or avoidance of an unpleasant stimulus. For example, a child cries when asked to clean up behavior, and the parent removes the cleaning demand. Aversive stimulus removed. If the crying increases in the future, it was negatively reinforced by escape. The behavior works because it makes something bad go away. Question 6. What is the primary role of a registered behavior technician, RBT? A. To design behavior intervention plans. B. To supervise other RBTs. C. To implement skill acquisition and behavior reduction plans developed by a supervisor. D. To conduct functional behavior assessments independently. Answer: C. To implement skill acquisition and behavior reduction plans developed by a supervisor. This question is about the defined responsibilities of an RBT. RBTs are paraprofessionals who work under the close supervision of a board-certified behavior analyst, BCABA, or board-certified assisted behavior analyst, BCABA. Their main job is to directly carry out the treatment plans that their supervisor creates, designing plans, A, supervising others, B, and conducting complex assessments independently, D, are roles for BCBAs or BCABA. Your primary role is to put the plan into action and collect data. RBTs are the implementers of the plan. Question 7. Which type of preference assessment involves presenting items one at a time to the client and recording their reaction or engagement? A. Paired stimulus. B. Multiple stimulus without replacement, MSWO. C. Free operant. D. Single stimulus. Answer: D. Single stimulus. This question describes the single stimulus preference assessment method, also known as successive choice. In this method, you present individual items to the client, one after another, and record whether they interact with the item and for how long. This helps determine if an item is preferred or not, but doesn't rank them against each other as directly as other methods. Paired stimulus: A. Presents 2 items at a time. MSWO. B. Presents multiple items and removes chosen ones. Free operant. C. Observes choices in a free access environment. You show them one thing at a time to see if they like it. Question 8. What is the definition of an antecedent? A. Something that happens immediately after a behavior. B. Something that happens immediately before a behavior. C. A consequence that increases behavior. D. A consequence that decreases behavior. Answer: B. Something that happens immediately before a behavior. This is another question about the ABC model. Antecedent is the event, stimulus, or condition that occurs right before a behavior. Understanding the antecedent helps us figure out the context in which the behavior happens and what might be triggering it. Option A describes a consequence. Options C and D describe types of consequences, reinforcement, and punishment. The antecedent is the A in ABC, what comes right before the behavior. Question 9. What is the term for the process of breaking down a complex skill into a sequence of smaller teachable steps? A. Shaping. B. Prompting. C. Task analysis. D. Generalization. Answer: C. Task analysis. This question asks for the specific term for taking a multi-step skill and listing out each individual step. A task analysis is the process used to break a complex skill, like brushing teeth, making a sandwich, or getting dressed, into a series of smaller, more manageable steps that can be taught one by one or as a sequence. Shaping: A. Is modifying a single behavior through approximations. Prompting: B. Is providing help. Generalization: D. Is applying skills in new ways. A task analysis gives you the step-by-step guide for teaching a longer skill. It's like making a list of all the tiny steps needed to do something bigger. Question 10. When using whole interval recording, you mark that the behavior occurred if A. It occurred at any point during the interval. B. It occurred throughout the entire interval. C. It occurred at the very end of the interval. D. The frequency count within the interval was high. Answer: B. It occurred throughout the entire interval. This question tests your understanding of whole interval recording. In this discontinuous measurement method, you divide the observation period into intervals. To mark yes for an interval, the target behavior must be happening continuously for the entire duration of that interval. If it stops even for a moment, you mark no. Option A is partial interval recording. Option C is momentary time sampling. Option D relates to frequency. The behavior has to fill the whole time box to be counted in whole interval recording. Question 11. What is the definition of punishment? A. A consequence that increases the future frequency of a behavior. B. A consequence that decreases the future frequency of a behavior. C. A stimulus that signals reinforcement is available. D. A procedure that stops a behavior from occurring immediately. Answer: B. A consequence that decreases the future frequency of a behavior. This question asks for the definition of punishment, a core concept in ABA. Punishment is any consequence that follows a behavior and results in a decrease in the future likelihood of that behavior happening again under similar circumstances. It can be positive, adding something aversive, or negative, removing something pleasant. But the defining feature is that it weakens the behavior. Option A describes reinforcement. Option C describes a discriminative stimulus, SD. Option D might be a temporary effect, but the definition is about the future frequency. Punishment makes the behavior happen less often in the future. Question 12. Which type of prompting involves demonstrating the correct response for the client? A. Verbal prompt. B. Physical prompt. C. Model prompt. D. Gestural prompt. Answer: C. Model prompt. This question asks about a specific type of prompt. A model prompt is when the RBT or another person performs the desired behavior so the client can imitate it. Verbal prompts: A. Use spoken words. Physical prompts: B. Involve touching or guiding the client. Gestural prompts: D. Involve pointing or making a motion. Showing the client how to do it is a model prompt. Question 13. What does IOA stand for? A. Individualized Outcome Assessment. B. Inter-Observer Agreement. C. Intervention Objective Analysis. D. Interval Observation Accuracy. Answer: B. Inter-Observer Agreement. This question asks for the full term represented by the acronym IOA, which is a standard term in ABA measurement. IOA stands for Inter-Observer Agreement. It is a measure of how consistently two independent observers record the same behavior data. Calculating IOA helps ensure the data being collected is reliable and accurate. IOA is about making sure two people saw and recorded the same thing. Question 14. When is it appropriate for an RBT to deviate from the written behavior plan? A. When the client's behavior is getting worse. B. When the client's parents request a change. C. When they believe a different procedure would be more effective. D. Never without instruction from their supervisor. Answer: D. Never without instruction from their supervisor. This question addresses the RBT's role and ethical responsibility regarding plan implementation. RBTs are implementers. They must follow the written behavior plan precisely as designed by their supervisor. They should never make independent changes to the plan or deviate from it without explicit instruction and training from their supervising BCBA or BCABA, regardless of the client's behavior. A. Parent requests. B. Or their own ideas. C. Your job is to follow the plan your supervisor gave you exactly. Question 15. What is the definition of latency measurement? A. Recording how long a behavior lasts. B. Counting the number of times a behavior occurs. C. Recording the time between the end of one behavior and the start of the next identical behavior. D. Recording the time between the presentation of a stimulus and the start of a behavior. Answer: D. Recording the time between the presentation of a stimulus and the start of a behavior. This question asks for the definition of latency. Latency is the measure of the time delay from when a stimulus is presented, like an instruction, cue, or event, to when the client begins to perform the target behavior. Option A is duration. Option B is frequency. Option C is interresponse time, IRT. Latency measures how long it takes for the client to start doing the behavior after they've been prompted or given a cue. It's the time from the instruction to the start of the action. Question 16. Which schedule of reinforcement involves reinforcing every single occurrence of a target behavior? A. Fixed ratio. B. Variable ratio. C. Continuous reinforcement. D. Intermittent reinforcement. Answer: C. Continuous reinforcement. This question asks about the schedule where the behavior is reinforced every time it happens. Continuous reinforcement, CRF, means that reinforcement is delivered immediately following every correct response. This schedule is typically used when first teaching a new skill because it helps the client quickly learn the connection between the behavior and the reward. Fixed ratio, A, and variable ratio, B, are types of intermittent reinforcement. D, where only some responses are reinforced. CRF is reinforcing continually or every time. Question 17. What is the primary purpose of a functional behavior assessment, FBA? A. To identify potential reinforcers for a client. B. To determine the function, purpose of a challenging behavior. C. To teach the client new skills. D. To decrease challenging behaviors immediately. Answer: B. To determine the function, purpose of a challenging behavior. This question asks about the main goal of conducting an FBA. An FBA is a process used to understand why a challenging behavior is happening. It involves gathering information about the antecedents, what happens before, and consequences, what happens after, to identify the function or purpose the behavior serves for the individual. Example: gaining attention, escaping a task, getting an item, sensory input. Identifying reinforcers, A, is done through preference assessments. Teaching skills, C, and decreasing behaviors, D, are outcomes of intervention, not the purpose of the assessment itself. An FBA is detective work to figure out the why behind a behavior. Question 18. When using partial interval recording, you mark that the behavior occurred if A. It occurred at any point during the interval. B. It occurred throughout the entire interval. C. It occurred at the very end of the interval. D. The frequency count within the interval was high. Answer: A. It occurred at any point during the interval. This question tests your understanding of partial interval recording. In this discontinuous measurement method, you divide the observation period into intervals. If the target behavior happens at any time within that interval, even for just a moment, you mark yes for that interval. Option B describes whole interval recording. Option C describes momentary time sampling. Option D relates to frequency. In partial interval, if the behavior just touches the time box, you count it. Question 19. What is the definition of discrimination training? A. Reinforcing successive approximations of a behavior. B. Teaching a client to respond differently to different stimuli. C. Breaking down a complex skill into smaller steps. D. Reinforcing a behavior in all environments. Answer: B. Teaching a client to respond differently to different stimuli. This question asks for the definition of discrimination training. Discrimination training is the process of teaching a client to respond in a specific way when a particular stimulus, the SD, is present and not respond in that way, or respond differently when a different stimulus, the S delta, is present. It involves reinforcing responses in the presence of the SD and withholding reinforcement, extinction, for responses in the presence of the S delta. Shaping, A, modifies a single behavior. Task analysis, C, breaks down skills. Reinforcing in all environments, D, is related to generalization. Discrimination training teaches the client to tell the difference between things and respond appropriately. Teach them to know when and where to do a behavior. Question 20. What is the ethical term for being truthful and honest in your professional activities? A, confidentiality. B, professional boundaries. C, integrity. D, responsibility. Answer: C, integrity. This question asks about the ethical principle related to honesty. Integrity means being honest, fair, and accurate in all aspects of your professional work, including data collection, reporting, communication, and representing your qualifications. Confidentiality, A, is about privacy. Professional boundaries, B, are about relationships. Responsibility, D, is about fulfilling your duties. Integrity is about being honest in everything you do as an RBT. Be honest in your work and with everyone you interact with professionally. Question 21. Which type of measurement is calculated by dividing the total count of a behavior by the total time of the observation period? A, frequency. B, duration. C, rate. D, latency. Answer: C, rate. This question asks for the measurement calculated by combining frequency and time. Rate is the frequency of a behavior occurring per unit of time, example per minute, per hour, per day. You calculate it by taking the total count, frequency, and dividing it by the length of the observation period, frequency. A is just the count. Duration, B, is how long it lasts. Latency, D, is time to start. Rate gives you the frequency with a time context. Rate is frequency over time. Question 22. What is the definition of an S delta, SD? A, a stimulus that signals reinforcement is available for a specific behavior. B, a stimulus that signals that reinforcement is not available for a specific behavior. C, a consequence that increases behavior. D, a consequence that decreases behavior. Answer: B, a stimulus that signals that reinforcement is not available for a specific behavior. This question asks for the definition of an S delta, which is used in discrimination training. An S delta is a stimulus present when a specific behavior is not reinforced. It's the red light indicating that performing the behavior in its presence will not lead to the desired outcome. An SD, A, signals reinforcement is available. Options C and D describe consequences. An S delta tells you, don't do the behavior now, you won't get the reward. Question 23. When using backward chaining, reinforcement is delivered after the client independently completes. A, only the very first step of the task analysis. B, only the very last step of the task analysis, initially. C, every step of the task analysis. D, any step in the task analysis. Answer: B, only the very last step of the task analysis, initially. This question asks about reinforcement in backward chaining. In this procedure, you teach the steps of a task analysis starting from the end. You prompt the client through all steps except the last one. Reinforcement is delivered immediately after the client independently completes the final step of the chain. Once the last step is mastered, you then teach the second to last step, reinforcing completion of that step, followed by the already mastered final step, and so on. The reward comes when they finish the job, starting with the last step. Question 24. Which ethical guideline requires RBTs to only perform tasks that they have been trained and are competent to do under supervision? A. Confidentiality. B. Professional boundaries. C. Scope of practice. D. Responsibility. Answer C. Scope of practice. This question asks about the ethical concept related to working within your qualifications. Your scope of practice as an RBT includes the tasks you are authorized and trained to perform under the supervision of a BCBA or BCABA. Ethically, you must stay within this scope and not attempt procedures or responsibilities you are not competent to handle. Confidentiality. A. Is privacy. Professional boundaries. B. Are about relationships. Responsibility. D. Is about fulfilling duties. Know your job duties and stick to them. Getting training for anything new. Question 25. What is the term for a consequence that, when presented immediately following a behavior, decreases the future likelihood of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer C. Positive punishment. This question asks for the definition of positive punishment. Punishment means the behavior decreases, and positive means something is added or presented. So, positive punishment is when a behavior becomes less likely in the future because an unpleasant stimulus is added immediately after it occurs. For example, a child touches a hot stove, behavior, and feels pain. Aversive stimulus added, the likelihood of touching the stove decreases. Adding something to make the behavior happen less often is positive punishment. Question 26. What is the primary difference between continuous and discontinuous measurement? A. Continuous measurement is easier to use. B. Discontinuous measurement is more accurate. C. Continuous measurement records every instance of the behavior. Discontinuous measurement samples the behavior. D. Discontinuous measurement is used only for challenging behaviors. Answer C. Continuous measurement records every instance of the behavior. Discontinuous measurement samples the behavior. This question asks about the fundamental difference between these two categories of measurement. Continuous measurement methods, like frequency, duration, latency, involve capturing every single occurrence or the full duration of the behavior. Discontinuous measurement methods, like interval recording or time sampling, only record if the behavior occurred during or at the end of specific intervals, capturing only a sample of the behavior. This is the core distinction. Ease of use, A, and accuracy, B, can vary. Discontinuous methods can be used for any behavior, not just challenging ones. D, continuous means you measure every time. Discontinuous means you take samples. Question 27. What is the term for a stimulus that has acquired reinforcing properties through being paired with a primary reinforcer? A. Primary reinforcer. B. Unconditioned stimulus. C. Conditioned stimulus. D. Conditioned reinforcer. Answer D. Conditioned reinforcer. This question asks for the term for a learned reinforcer. A conditioned reinforcer, also called a secondary reinforcer, is a stimulus that was initially neutral but became reinforcing because it was repeatedly presented alongside a primary, unconditioned reinforcer or another established conditioned reinforcer. Examples include praise, tokens, or money. A primary reinforcer, A, is unlearned. A conditioned stimulus, C, is a term from classical conditioning, signaling an upcoming event, not necessarily a reinforcer. An unconditioned stimulus, B, naturally triggers a response. You learned that this thing is a reward because it came with other good things. Question 28. When using forward chaining, reinforcement is delivered after the client independently completes. A, only the very first step of the task analysis. Initially. B, only the very last step of the task analysis. C, every step of the task analysis. D, any step in the task analysis. Answer: A. Only the very first step of the task analysis. Initially, this question asks about reinforcement in forward chaining. In this procedure, you teach the steps of a task analysis starting from the beginning. You reinforce the client for independently completing the first step in the chain. Once that step is mastered, you continue to reinforce completion of the first step and the next step together, and so on, gradually adding more steps to the reinforcement requirement as they are mastered. Reinforcing the last step, B, is backward chaining. Reinforcing every step, C, or any step, D, isn't the specific procedure. You reward them for doing the first step alone. Question 29. What is the ethical guideline that prohibits RBTs from having personal relationships with clients or their families outside of the professional role? A. Confidentiality. B. Dual relationships/professional boundaries. C. Integrity. D. Responsibility. Answer: B. Dual relationships/professional boundaries. This question asks about maintaining a clear professional relationship. Dual relationships occur when you have more than one role with a client, example RBT, and friend RBT, and family member. Ethical guidelines require RBTs to avoid these to maintain objectivity and prevent conflicts of interest or exploitation. Professional boundaries is a related concept about keeping the relationship appropriate. Confidentiality, A, is privacy. Integrity, C, is honesty. Responsibility, D, is duty. Keep your relationship with clients and their families strictly professional. Question 30. When visually analyzing data on a graph, what does trend refer to? A. How much the data points bounce around. B. The average value of the data points. C. The overall direction of the data path, increasing, decreasing, or flat. D. When the intervention was changed. Answer: C. The overall direction of the data path, increasing, decreasing, or flat. This question asks about interpreting the trend on a graph. Trend refers to the overall direction or slope of the data path. Is the behavior generally increasing over time, upward trendy, decreasing, downward trendy, or staying about the same, flat trendy? Variability. A, is how much the points bounce around. Level. B, is the average value. Phase change lines. D, indicate intervention changes. Trend shows you if the behavior is generally getting better, worse, or staying the same over time. Question 31. What is the term for providing reinforcement for a behavior that is different from the challenging behavior, but serves the same function? A. DRO, differential reinforcement of other behavior. B. DDRA, differential reinforcement of alternative behavior. C. DDRI, differential reinforcement of incompatible behavior. D. DDRL, differential reinforcement of low rates. Answer: B. DDRA, differential reinforcement of alternative behavior. This question asks about a specific type of differential reinforcement. Differential reinforcement of alternative behavior, DDRA, involves reinforcing a behavior that is a desirable alternative to the challenging behavior. The alternative behavior doesn't have to be physically incompatible, but it should achieve the same outcome or function for the client as the challenging behavior. DRO, A, reinforces the absence of the behavior, DRI. C, reinforces a behavior physically impossible to do at the same time. DDRL, D, reinforces low rates. You are reinforcing a better way for them to get what they want or need. Question 32. When using momentary time sampling, you mark that the behavior occurred if A, it occurred at any point during the interval. B, it occurred throughout the entire interval. C, it occurred at the very end of the interval. D, you saw it happen just before the timer beeped. Answer: C, it occurred at the very end of the interval. This question tests your understanding of momentary time sampling. In this discontinuous measurement method, you divide the observation period into intervals. You only look to see if the target behavior is occurring at the precise moment the interval ends, when a timer goes off. If the behavior is happening at that exact moment, you mark yes. If not, you mark no. Option A is partial interval. Option B is whole interval. Option D is incorrect because you only check at the end of the interval. You only check if they are doing it right when the timer beeps. Question 33. What is the definition of interresponse time, IRT? A. Recording how long a behavior lasts. B. Recording the time between the start of a stimulus and the start of a behavior. C. Recording the time between two consecutive occurrences of the same behavior. D. Counting the number of times a behavior occurs. Answer C. Recording the time between two consecutive occurrences of the same behavior. This question asks for the definition of IRT. Interresponse time, IRT, is a continuous measurement that records the time elapsed between the end of one instance of a behavior and the beginning of the next instance of the same behavior. It's often used to measure the pace of behavior. Duration, A, is how long a single instance lasts. Latency, B, is time from stimulus to start. Frequency, D, is a count. IRT measures the time between one behavior ending and the next one starting. Question 34. What should an RBT do if they are unsure how to implement a procedure in a client's behavior plan? A. Ask the client's parent how they do it. B. Look it up online. C. Skip the procedure for that session. D. Ask their supervisor for clarification and training. Answer D. Ask their supervisor for clarification and training. This question addresses the RBT's reliance on supervision and the ethical requirement of competence. If you are unsure about any part of a behavior plan or procedure, you must seek guidance from your supervisor. They are responsible for ensuring you are trained and competent. Asking parents, A, or looking online, B, might provide information, but it's not the official guidance for implementing the specific plan and could lead to errors. Skipping the procedure, C, means the client isn't receiving the planned treatment. Always go to your supervisor with questions about the plan. If you don't understand something in the plan, ask your supervisor to explain and show you. Question 35. What is the term for a procedure where reinforcement is provided contingent on the target behavior occurring at a lower rate than a predetermined criteria? A. DRO. Differential reinforcement of other behavior. B. DRA. Differential reinforcement of alternative behavior. C. DRI. Differential reinforcement of incompatible behavior. D. DRL. Differential reinforcement of low rates. Answer D. DRL. Differential reinforcement of low rates. This question asks about a specific differential reinforcement procedure used when the goal is to reduce, but not eliminate, a behavior. Differential reinforcement of low rates. DRL reinforces the behavior only if it occurs at a rate lower than a certain level or after a minimum amount of time has passed since the last instance. DRO, A, reinforces the absence of the behavior, DRA. B, reinforces an alternative behavior, DRI. C, reinforces an incompatible behavior. DRL is used to make a behavior happen less often, but still sometimes. You're reinforcing the behavior, but only when it happens slowly or not too much. Question 36. Which ethical guideline requires RBTs to follow through on their professional commitments? A. Integrity. B. Professional boundaries. C. Responsibility. D. Beneficence. Answer C. Responsibility. This question asks about the ethical principle related to your duties and obligations. Responsibility includes being reliable, following through on your commitments, like attending sessions, collecting data, implementing plans, and performing your duties professionally. Integrity, A, is honesty. Professional boundaries, B, are about relationships. Beneficence, D, is doing good. Being responsible means doing what you say you're going to do as an RBT. Question 37. What is the definition of stimulus generalization? A, performing different behaviors that serve the same function. B, responding differently to different stimuli. C, performing a learned behavior in the presence of novel, untrained stimuli. D, maintaining a learned behavior over time. Answer: C, performing a learned behavior in the presence of novel, untrained stimuli. This question asks for the definition of stimulus generalization. Stimulus generalization occurs when a client performs a learned behavior in the presence of new stimuli or settings that are similar to the original stimulus where the behavior was taught, without being specifically trained to respond in those new conditions. Option A describes response generalization. Option B describes discrimination. Option D describes maintenance. The behavior spreads to new places or things. Question 38. When assisting with a functional analysis, your supervisor tells you that in the play/control condition, you should provide attention and tangibles freely and present no demands. If the client engages in the target behavior, you should provide no consequence. What is the likely purpose of this play/control condition? A, to test if the challenging behavior is maintained by escape from demands. B, to test if the challenging behavior is maintained by attention. C, to test if the challenging behavior is maintained by access to tangibles. D, to serve as a baseline or comparison condition where potential maintaining variables are freely available. Answer: D, to serve as a baseline or comparison condition where potential maintaining variables are freely available. This question describes the standard play or control condition in a functional analysis. In this condition, the client has free access to attention and tangibles, and no demands are placed. This is done to minimize the deprivation for potential social reinforcers and escape from demands, providing a baseline of behavior in a relatively enriched environment. Challenging behavior is not reinforced. This condition serves as a comparison point to the test conditions. Attention, escape, tangible, where specific consequences are made contingent on the behavior to see if those consequences increase the behavior relative to this control condition. It's the everything is available and easy, let's see what happens condition to compare others against. Question 39. What does IOA measure? A, the effectiveness of an intervention. B, the agreement between two or more observers measuring the same behavior. C, the preference of a client for different items. D, the function of a challenging behavior. Answer: B, the agreement between two or more observers measuring the same behavior. This question asks about the purpose of IOA, inter-observer agreement. IOA is a measure of how reliable the data collection is. It is calculated by having two or more people independently collect data on the same behavior at the same time, and then comparing their recordings to see if they agree. High IOA suggests the data is likely accurate, and the operational definition is clear. Effectiveness, A, is seen in the data trend. Preference, C, is from preference assessment. Function, D, is from FBA. IOA checks if different people see and record the same thing. Question 40. Which ethical principle requires RBTs to avoid taking advantage of clients or their families for personal gain? A, integrity. B, beneficence. C, avoiding exploitation/conflict of interest. D, confidentiality. Answer: C, avoiding exploitation/conflict of interest. This question asks about the ethical principle related to preventing misuse of the professional relationship. Exploitation is taking advantage of a power difference, and a conflict of interest is when your personal interests interfere with your professional duties. Ethically, RBTs must avoid any situation that could lead to them taking advantage of a client or family for personal benefit, whether financial, social, or otherwise. Integrity. A. Is honesty. Beneficence. B. Is doing good. Confidentiality. D. Is privacy. Do not use your job or relationship with the client to get things for yourself. Question 41. When using a DRL procedure, you are reinforcing A. The absence of the challenging behavior. B. A specific alternative behavior. C. A behavior that is physically incompatible with the challenging behavior. D. The challenging behavior, but only when it occurs infrequently or after a certain time delay. Answer: D. The challenging behavior, but only when it occurs infrequently or after a certain time delay. This question asks about what behavior is reinforced in DRL, differential reinforcement of low rates. DRL is unique among differential reinforcement procedures because you are actually reinforcing the target challenging behavior, but only when it occurs at a low rate. This is used when the goal is to reduce the behavior, but not eliminate it entirely. DRO. A. Reinforces absence. DRA. B. Reinforces alternatives. DRI. C. Reinforces incompatibles. DRL rewards the problem behavior, but only if you don't do it too much or too fast. Question 42. What is the ethical guideline that requires RBTs to ensure their training and supervision are current and meet the necessary standards? A. Integrity. B. Responsibility. C. Professional competence. D. Confidentiality. Answer: C. Professional competence. This question asks about the ethical principle related to maintaining skills and knowledge. Professional competence involves having the necessary skills and knowledge to perform your job effectively and safely. For RBTs, this includes ensuring your initial training is complete, passing the competency assessment, meeting ongoing supervision requirements, and staying current with your certification requirements. Integrity. A. Is honesty. Responsibility. B. Is fulfilling duties. Confidentiality. D. Is privacy. Keep your skills sharp and your training/supervision up to date. Make sure you have the right training and supervision to do your job well. Question 43. When providing a physical prompt, the level of contact should be A. As firm as possible to ensure the client complies. B. Just enough to guide the client's movement. C. Only hand-over-hand guidance. D. Determined by the client's preference. Answer: B. Just enough to guide the client's movement. This question addresses the appropriate use of physical prompts. When providing physical guidance, it should be the minimum amount of pressure or contact necessary to guide the client through the desired movement. The goal is to provide assistance, not to force compliance with excessive force. A. While hand-over-hand, C, is one type, other physical prompts exist. Client preference. D, is important for rapport, but the amount of physical help is primarily determined by what's needed for the client to perform the skill and should be part of a supervised plan. Use only the amount of physical help needed to guide them, not force them. Question 44. What is the definition of a behavior? A. Any action a person takes. B. Anything a living organism does that is observable and measurable. C. Only challenging actions a person takes. D. A person's thoughts and feelings. Answer: B. Anything a living organism does that is observable and measurable. This question asks for the definition of behavior from an ABA perspective. In ABA, behavior is broadly defined as any action or response emitted by a living organism that can be observed and measured. This includes not just obvious actions like talking or walking, but also private events like thinking or feeling, if they can be made observable or are inferred from observable behavior. However, for RBTs, the focus is primarily on publicly observable behavior. Challenging actions, C, are just one type, thoughts and feelings. D are considered private behaviors, but are often studied indirectly. Behavior is anything a person does that you can see or hear and count or measure. Question 45. Which type of graph is best suited for showing changes in behavior over time? A. Bar graph. B. Pie chart. C. Line graph. D. Scatter plot. Answer: C. Line graph. This question asks about the standard graph used in ABA to show trends over time. Line graphs are the most common and appropriate graphs in ABA because they allow for visual analysis of how a behavior changes across sessions, days, or other units of time. The data points for consecutive time periods are connected by a line, which clearly shows the trend and variability. Bar graphs, A, are better for comparing different items or conditions. Pie charts, B, show parts of a whole. Scatter plots, D, show correlations between two variables. Use a line graph to see the behavior's path over time. Question 46. What is the ethical guideline that requires RBTs to collaborate with other professionals working with the client when appropriate? A. Confidentiality. B. Professional collaboration and coordination. C. Dual relationships. D. Scope of practice. Answer: B. Professional collaboration and coordination. This question asks about working together with other people involved in the client's care. Ethical guidelines encourage collaboration and coordination among professionals, like teachers, speech therapists, occupational therapists, involved in a client's services to ensure a cohesive approach and benefit the client. This requires appropriate communication with the supervisor and respecting confidentiality agreements. Confidentiality, A, is privacy. Dual relationships, C, are about avoiding personal relationships. Scope of practice, D, is about your role. Working together as a team for the client's benefit is professional collaboration. Work with other people involved in the client's life when your supervisor says it's appropriate. Question 47. When creating a task analysis, what is the most important characteristic of each step? A. It must take approximately the same amount of time as other steps. B. It must be something the client can already do independently. C. It must be observable and measurable. D. It must be a motor behavior, something physically done. Answer: C. It must be observable and measurable. This question asks about a key characteristic of good steps in a task analysis. Each step in a task analysis must be defined clearly enough that it is observable, you can see or hear it happening, and measurable, you can count or record whether it happened correctly. This allows for consistent teaching and data collection. Steps do not need to be the same length, A, or something the client can already do, B. While many steps are motor behaviors, some skills might include verbal steps or other observable actions. D. Make sure each step in your list is something you can see them do and check off. Question 48. Which schedule of reinforcement is often used to maintain behaviors after they have been learned on a continuous reinforcement schedule? A. Continuous reinforcement, CRF. B. Intermittent reinforcement. C. Fixed interval, FI. D. Fixed ratio, FR. Answer: B. Intermittent reinforcement. This question asks about the type of schedule used after initial learning with CRF. Once a behavior is learned and happening consistently on a CRF schedule, it is typically transitioned to an intermittent schedule. Intermittent schedules, like FR, VR, FI, VI, reinforce only some instances of the behavior, which helps the behavior become more durable, happen at a higher rate, and be more resistant to extinction. CRF, A, is for initial teaching, FI, C, and FR. D are types of intermittent schedules, but intermittent reinforcement is the general term for any schedule where not every response is reinforced. Once they've learned it, switch to rewarding them only some of the time. Question 49. What is the potential negative effect of using prompts that are too intrusive for the client's skill level? A. It might make the client anxious. B. It could lead to prompt dependency. C. The client might not get enough reinforcement. D. It always makes the behavior decrease. Answer: B. It could lead to prompt dependency. This question addresses a risk associated with prompting. Prompt dependency occurs when a client becomes reliant on prompts to perform a behavior and doesn't learn to respond to the natural SD independently. Using prompts that provide too much help for what the client is capable of can increase the risk of prompt dependency, as the client isn't required to exert effort or attend to the natural cue. While other effects might occur, C is incorrect as prompts aim to increase behavior. Prompt dependency is a key concern related to prompt intrusiveness and fading. If you give too much help for too long, they might never learn to do it on their own. Question 50. What is the definition of maintenance in ABA? A. Performing a learned skill in new environments. B. Performing different behaviors that serve the same function. C. Continuing to perform a learned skill after direct teaching has been reduced or stopped. D. Responding differently to different stimuli. Answer: C. Continuing to perform a learned skill after direct teaching has been reduced or stopped. This question asks for the definition of maintenance. Maintenance refers to the extent to which a client continues to perform a learned behavior accurately and reliably over time, even after the formal teaching procedures and reinforcement schedules have been thinned or removed. It's about the skill lasting. Performing in new environments, A, is stimulus generalization. Performing different behaviors, B, is response generalization. Responding differently to stimuli, D, is discrimination. Maintenance is about the skill sticking around after you stop actively teaching it so much. Question 51. When using differential reinforcement, you are decreasing a challenging behavior by A. Punishing the challenging behavior every time it occurs. B. Providing reinforcement for the challenging behavior on a variable schedule. C. Reinforcing an alternative behavior or the absence of the challenging behavior, while withholding reinforcement for the challenging behavior. D. Removing the client from the environment when the challenging behavior occurs. Answer: C. Reinforcing an alternative behavior or the absence of the challenging behavior, while withholding reinforcement for the challenging behavior. This question asks about the mechanism of differential reinforcement as a behavior reduction strategy. Differential reinforcement works by reinforcing a desired behavior, either a specific alternative behavior like in DRA/DRI, or any behavior other than the challenging behavior like in DRO, while simultaneously implementing extinction for the challenging behavior, withholding the reinforcement that maintained it. This makes the desired behavior more likely to occur because it gets reinforced, while the challenging behavior becomes less likely because it does not. Punishment, A, is a different procedure. Reinforcing challenging behavior, B, would increase it. Removing from the environment, D, is timeout. You are reinforcing something good instead of reinforcing the problem behavior. Question 52. What is the primary ethical responsibility of an RBT if they suspect abuse or neglect of a client? A, to confront the suspected abuser. B, to document the suspicion and monitor the situation. C, to immediately report the suspicion to their supervisor and/or appropriate authorities. D, to discuss the suspicion with the client's family. Answer: C, to immediately report the suspicion to their supervisor and/or appropriate authorities. This question addresses the mandatory reporting requirement for RBTs. If you suspect abuse or neglect, you are legally and ethically obligated to report it immediately. The specific reporting procedure involves informing your supervisor and/or contacting the relevant child or adult protective services agency, following your agency's policy and local laws. Confronting the abuser, A, can be dangerous. Documenting, B is necessary but not sufficient. Reporting is the required immediate action. Discussing with the family, D, might compromise the investigation and could violate protocol. If you suspect abuse or neglect, report it right away to the right people. Question 53. What is the definition of shaping? A. Reinforcing a client for completing steps of a task analysis. B. Reinforcing behaviors that are successively closer approximations to the target behavior. C. Providing reinforcement only when a behavior occurs in certain situations. D. Teaching a client to imitate a model. Answer: B. Reinforcing behaviors that are successively closer approximations to the target behavior. This question asks for the definition of shaping, a procedure used to teach new behaviors that aren't currently in the client's repertoire. Shaping involves reinforcing responses that resemble the target behavior and then gradually only reinforcing responses that are closer and closer to the final desired form of the behavior until the client performs the target behavior reliably. Task analysis. A. It's for chaining. Discrimination. C. Is about responding differently to stimuli. Imitation. D. Is a type of skill taught, often using modeling prompts. You are gradually molding a behavior by rewarding closer and closer tries. Question 54. When using a token economy, what are the tokens considered? A. Primary reinforcers. B. Unconditioned punishers. C. Conditioned reinforcers. D. Aversive stimuli. Answer: C. Conditioned reinforcers. This question asks about the type of reinforcer tokens are. Tokens or points, stickers, etc. are not naturally reinforcing. They gain their value because they are paired with or can be exchanged for backup reinforcers that are already reinforcing, either primary or other conditioned reinforcers. Therefore, tokens are considered conditioned, learned reinforcers. Primary reinforcers, A, are unlearned. Unconditioned punishers, B, and aversive stimuli. D are unpleasant things that decrease behavior or are avoided. You learn that tokens are good because they can be traded for things you like. Question 55. Which term describes the stimulus that is present when a behavior is reinforced? A. S delta, SD. B. Motivating operation, MO. C. Conditioned reinforcer. D. Discriminative stimulus, STI. Answer: D. Discriminative stimulus, STI. This question asks for the term for the stimulus that signals that reinforcement is available for a specific behavior. The discriminative stimulus, STI, is an antecedent stimulus that, when present, indicates that a particular response will be reinforced. It sets the occasion for the behavior. An S delta, A, signals that reinforcement is not available. A motivating operation, B, changes the value of the reinforcer. A conditioned reinforcer, C, is a type of learned reward. The SD is the go signal for the behavior to get the reward. Question 56. When collecting data using a narrative recording method, you are essentially A. Counting specific behaviors. B. Timing the duration of behaviors. C. Writing a descriptive account of events. D. Checking for behavior occurrence in intervals. Answer: C. Writing a descriptive account of events. This question asks about the nature of narrative recording. Narrative recording involves writing detailed anecdotal notes about what happens during an observation period, including descriptions of antecedents, behaviors, consequences, and the context. It's a descriptive method rather than a strictly quantitative measurement like counting. A. Timing. B. Or interval recording. D. You are telling the story of what you observed. Question 57. What ethical guideline is most relevant when considering if a client has the capacity to provide informed consent? A. Confidentiality. B. Integrity. C. Respect for autonomy related to consent/assent. D. Beneficence. Answer C. Respect for autonomy, related to consent/assent. This question relates to the client's right to make decisions about their own treatment. The ethical principle of respect for autonomy means respecting the individual's right to self-determination and making informed choices about their participation in services. This is the foundation of informed consent, which requires the person to understand the procedures, risks, and benefits. For clients who cannot provide formal consent, obtaining assent, demonstrated willingness to participate, is an ethical consideration tied to this principle. Confidentiality, A, is privacy. Integrity, B, is honesty. Beneficence, D, is doing good. Respecting their right to choose involves ensuring they understand and agree to services if possible. Question 58. If a client engages in a behavior and immediately receives attention from a therapist, and the behavior increases in the future, what function is the behavior likely serving? A, escape. B, tangible. C, attention. D, automatic. Answer C, attention. This question asks you to identify the likely function based on the ABCs. The behavior occurs and is followed by social interaction or notice from another person. Attention. If this consequence makes the behavior happen more often in the future, the behavior is likely maintained by attention. Escape, A, is getting away from something. Tangible, B, is getting an item. Automatic, D, is sensory input. If getting attention makes the behavior happen more, the function is likely attention. Question 59. When working with a client, you should always prioritize A, the client's favorite activities. B, the easiest skills to teach. C, client safety and well-being. D, collecting data efficiently. Answer C, client safety and well-being. This question addresses the ultimate priority in ABA service delivery, while incorporating preferences A, teaching efficiently, B, and collecting data. D are important aspects of the job. The ethical responsibility to ensure the client's safety and promote their overall well-being is paramount and always the first priority in any situation. Client safety comes before everything else. Question 60. Which measurement method is used to record the amount of time that elapses between the beginning of one instance of behavior and the beginning of the next instance of the same behavior? A, duration. B, latency. C, interresponse time, IRT. D, frequency. Answer C, interresponse time, IRT. This question asks for the definition of IRT, slightly rephrased from Q33. IRT is the time from the start of one behavior instance to the start of the next identical behavior instance. More commonly, it's defined as the time from the end of one behavior to the start of the next. However, the core idea is the time between occurrences of the same behavior. Duration, A, is how long one instance lasts. Latency, B, is time from a stimulus to the first behavior start. Frequency, D, is a count. It's the time gap between two times the behavior happens. Question 61. What is the purpose of a prompting hierarchy? A, to determine the function of a behavior. B, to provide a systematic way to increase or decrease the amount of assistance given to a client. C, to identify potential reinforcers. D, to measure the frequency of a behavior. Answer B, to provide a systematic way to increase or decrease the amount of assistance given to a client. This question asks about the function of using a hierarchy for prompts. A prompting hierarchy is a predetermined order of prompts ranging from most to least intrusive, or vice versa. It provides a systematic guide for the RBT to follow when providing assistance, ensuring consistency in how prompts are delivered and faded or increased according to the chosen prompting strategy. MTL or LTM. Function A is from FBA. Reinforcers C are from preference assessments. Frequency D is a measurement. A hierarchy gives you the steps for giving more or less help in an organized way. Question 62. What is the term for a consequence that, when removed immediately following a behavior, decreases the future likelihood of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer D. Negative punishment. This question is identical to question 41. Let's replace it with a new question. Revise ED question 62. What is the ethical responsibility of an RBT if they are asked to work with a client whose needs require expertise that the RBT does not possess, and their supervisor does not provide adequate training or support? A. Work with the client anyway and learn on the job. B. Inform the supervisor that they do not feel competent to work with this client and may need to be assigned to a different case or receive specific training/support. C. Ask the client's parents to provide the necessary training. D. Only work on the easiest goals with that client. Answer B. Inform the supervisor that they do not feel competent to work with this client and may need to be assigned to a different case or receive specific training/support. This question addresses the RBT's ethical obligation regarding competence and the supervisor's responsibility. If you are assigned to a client whose needs are beyond your skills, or if your supervisor isn't providing sufficient training for a complex case, you must speak up. Ethically, you cannot work outside your competence, especially if it could compromise the client's treatment or safety. You should communicate your concerns to your supervisor so they can either provide the necessary training, adjust the client's plan, or assign a different RBT who is a better match. Learning on the job, A, is inappropriate if it means working outside your scope. Asking parents, C, is not their role. Only working on easy goals, D, means the client isn't receiving all necessary services. If the client's needs are beyond your training, you must tell your supervisor so the client gets the right support. Question 63. What is the definition of an establishing operation, EO? A. A stimulus that signals that reinforcement is available. B. A motivating operation that increases the effectiveness of a reinforcer and the frequency of behavior that has been reinforced by that stimulus. C. A consequence that increases the future frequency of a behavior. D. A procedure that decreases the value of a reinforcer. Answer B. A motivating operation that increases the effectiveness of a reinforcer and the frequency of behavior that has been reinforced by that stimulus. This question asks for the definition of an establishing operation. One type of motivating operation, MO. An EO is an environmental event or condition, like being hungry, that makes a specific stimulus more effective as a reinforcer, makes food more valuable, and makes behaviors that have previously resulted in that stimulus more likely to occur, makes you more likely to look for foodie. Option A describes an SD. Option C describes reinforcement. Option D describes an abolishing operation, AO. The opposite type of MO. An EO makes you really want the reward, which makes you more likely to work for it. Question 64. Which type of IOA calculation is appropriate for frequency data collected within intervals, where you compare the number of instances recorded by two observers in each interval and calculate an average percentage of agreement across all intervals? A. Total count IOA. B. Mean count per interval IOA. C. Exact match IOA. D. Trial by trial IOA. Answer B. Mean count per interval IOA. This question describes mean count per interval IOA. This method is used for frequency data collected within specific time intervals. You calculate the IOA for each interval, smaller count / larger count * 100, and then find the average of these percentages across all intervals. Total count IOA. A. Compares only the overall totals. Exact match IOA. C. requires agreement on the timing of each instance, trial-by-trial IOA. D is for discrete trials. This method gives you a more granular look at agreement within smaller time chunks compared to just a total count comparison. You check agreement in each little time box and average the scores. Question 65. What is the ethical term for the obligation to ensure services are delivered in a manner that respects the client's background, beliefs, and preferences? A. Confidentiality. B. Cultural responsiveness. C. Beneficence. D. Justice. Answer: B. Cultural responsiveness. This question asks about the ethical consideration related to cultural differences. Cultural responsiveness means being aware of and respecting the client's cultural background, values, and practices, and tailoring interventions in a way that is sensitive to and effective within that cultural context. Confidentiality: A. is privacy. Beneficence: C. is doing good. Justice: D. is fairness. Providing culturally responsive services is an ethical mandate. Be mindful of and respect the client's cultural background. Question 66. When is it appropriate to discontinue a behavior reduction plan for a challenging behavior? A. When the RBT feels the behavior is no longer a problem. B. When the behavior has consistently decreased to a level that meets the mastery criterion specified in the plan, and the supervisor approves discontinuation. C. When the client's parents request that it be stopped. D. When an extinction burst occurs. Answer: B. When the behavior has consistently decreased to a level that meets the mastery criterion specified in the plan, and the supervisor approves discontinuation. This question addresses when an intervention is considered complete. Behavior plans have specific goals and mastery criteria. Example: behavior occurs less than 1 time per week for 4 consecutive weeks. A plan should be discontinued or modified only when the data shows the criterion has been consistently met, and this decision is made and approved by the supervisor who designed the plan. The RBT's feelings, A, or parent requests, C, are not sufficient reasons without supervisor approval based on data. An extinction burst, D, is a sign the plan might be working, not a reason to stop. The data tells you when the behavior has decreased enough according to the plan, and your supervisor makes a final call. Question 67. What is the ethical guideline that requires RBTs to be truthful and accurate in all communications related to their work? A. Confidentiality. B. Professional boundaries. C. Integrity. D. Responsibility. Answer: C. Integrity. This question is identical to question 20. Let's replace it with a new question. REVISED question 67. You are assisting with a functional analysis. Your supervisor tells you that in the escape condition, you should present the client with demands, provide minimal attention or tangibles, and if a client engages in the target behavior, you should immediately remove the demand for a brief period. What is the likely purpose of this escape condition? A. To test if the challenging behavior is maintained by escape from demands. B. To test if the challenging behavior is maintained by attention. C. To test if the challenging behavior is maintained by access to tangibles. D. To serve as a baseline or comparison condition. Answer: A. To test if the challenging behavior is maintained by escape from demands. This question describes a condition often used in a functional analysis to test for the escape function. In the escape condition, demands are presented, creating an aversive situation. And if the challenging behavior occurs, the demand is immediately removed, allowing escape. If the behavior occurs frequently in this condition, it suggests it is maintained by getting out of demands. Attention, B, and tangible, C, are tested in conditions where those consequences are provided following the behavior. The control condition, D, provides free access to reinforcement and no demands. This condition is set up to see if they do the behavior to get out of doing something difficult or unpleasant. Question 68. When calculating the percentage of opportunities for a discrete trial program, you divide the number of independent correct responses by A. The total number of responses, correct plus incorrect. B. The total number of trials presented. C. The total time of the session. D. The mastery criterion for the skill. Answer: B. The total number of trials presented. This question tests your calculation of percentage of opportunity data, typically used in DTT or similar structured teaching. To get the percentage, you take the number of times the client responded correctly independently, or whatever response definition you are measuring, and divide it by the total number of times you gave them the opportunity to respond, the total number of trials presented. This gives you a percentage of successful trials. Option A might be used in some contexts, but not standard percentage of opportunity. Time, C, is for rate or duration. Mastery criterion, D, is the goal, not used in the calculation itself. Percentage of opportunity tells you how often they got it right out of all the chances you gave them. Question 69. What is the ethical guideline that emphasizes treating clients with dignity and respect? A. Confidentiality. B. Beneficence. C. Integrity. D. Maintaining client dignity. Answer: D. Maintaining client dignity. This question asks about the ethical principle specifically related to respecting the individual worth of the client. Maintaining client dignity means treating clients with respect, considering their preferences and choices to the extent possible and safe, protecting their privacy, and interacting with them in a way that honors their individuality and humanity. Confidentiality, A, is privacy. Beneficence, B, is doing good. Integrity, C, is honesty. Treat every client with respect, just like you would want to be treated. Question 70. Which type of prompt should be faded as quickly as possible to avoid prompt dependency? A. Natural stimulus. B. Stimulus prompt. C. Response prompt. D. Unconditioned stimulus. Answer: C. Response prompt. This question asks about the type of prompt that is directly added to the client's response to make it more likely and which needs careful fading. Response prompts, like verbal, gestural, modal, or physical prompts, are behaviors of the therapist or others that help the client make the correct response. These are the prompts that are most prone to leading to prompt dependency if not faded systematically and quickly. Stimulus prompts, B, involve changing the stimulus itself. Example, making the correct answer bigger. Natural stimulus, A, is the cue you want them to respond to independently. In unconditioned stimulus, D, is naturally evoking a response. Prompts that involve you helping the client directly with their response should be faded out quickly. Question 71. What is the difference between positive punishment and negative punishment? A. Positive punishment increases behavior. Negative punishment decreases behavior. B. Positive punishment adds a stimulus. Negative punishment removes a stimulus. C. Positive punishment is always physical. Negative punishment is always removal of tangibles. D. Positive punishment is more effective than negative punishment. Answer: B. Positive punishment adds a stimulus. Negative punishment removes a stimulus. This question asks for the defining difference between positive and negative punishment. Both positive and negative punishment result in a decrease in behavior. The difference lies in whether a stimulus is added, positive, or removed, negative, as the consequence for the behavior. Positive punishment adds something aversive, like a painful stimulus. Negative punishment removes something pleasant, like taking away a toy. Option A is incorrect. Both decrease behavior. Option C is incorrect. Both can involve various types of stimuli. Option D is incorrect. Effectiveness varies. The difference is whether you are adding something or taking something away to decrease the behavior. Question 72. What is the definition of extinction? A procedure that decreases the future frequency of a behavior by adding an aversive stimulus. B. A procedure that decreases the future frequency of a behavior by removing a pleasant stimulus. C. A procedure that decreases the future frequency of a behavior by withholding the reinforcement that previously maintained it. D. A procedure that stops a behavior from occurring immediately. Answer: C. A procedure that decreases the future frequency of a behavior by withholding the reinforcement that previously maintained it. This question asks for the definition of extinction. Extinction is implemented by identifying the reinforcement that is maintaining a behavior and then stopping the delivery of that specific reinforcement whenever the behavior occurs. This leads to a decrease in the behavior over time. Options A and B describe types of punishment. Option D describes a potential immediate effect of some procedures, but extinction is a process that takes time. Extinction is stopping the reward for a behavior that used to get one. Question 73. When implementing a skill acquisition plan, what does it mean to master a skill? A. The client performed the skill correctly one time. B. The client performed the skill independently for a set number of trials or sessions as specified in the plan. C. The client stated that they know how to do the skill. D. The client's parent says the client has mastered the skill. Answer: B. The client performed the skill independently for a set number of trials or sessions as specified in the plan. This question asks about how mastery is defined in ABA programming. Mastery of a skill is achieved when the client consistently performs the target behavior correctly and independently according to a predetermined criterion specified in the skill acquisition plan example, 90% independent correct responses over 3 consecutive sessions. Doing it correctly once, A, isn't enough for mastery. Client or parent claims, C, D, are subjective and not the objective criterion. Mastery is meeting the goal level consistently as written in the plan. Meeting the goal number of correct tries on their own for a few sessions means they've mastered it. Question 74. What is the ethical responsibility of an RBT regarding data collection? A. To collect data only when the client is making progress. B. To collect data accurately and honestly as outlined in the behavior plan. C. To adjust data if it doesn't show the expected trend. D. To only collect data on challenging behaviors. Answer: B. To collect data accurately and honestly as outlined in the behavior plan. This question addresses the RBT's ethical duty related to data. Accurate and honest data collection is fundamental to ABA because it is used to make decisions about client treatment. You must collect data precisely as specified in the plan, record it accurately, and never falsify or manipulate it. Collecting data only when progress is seen, A, is unethical. Adjusting data, C, is falsification. Collecting data only on challenging behaviors, D, ignores skill acquisition goals. Collect the data exactly as you're told and be honest about what you record. Question 75. What is the term for a procedure where you reinforce a behavior that is physically impossible for the client to do at the same time as the challenging behavior? A. DRO, differential reinforcement of other behavior. B. DRA, differential reinforcement of alternative behavior. C. DDRI, differential reinforcement of incompatible behavior. D. DRL, differential reinforcement of low rates. Answer: C. DRI, differential reinforcement of incompatible behavior. This question asks about a specific type of differential reinforcement, where the desired behavior and the challenging behavior cannot happen simultaneously. Differential reinforcement of incompatible behavior, DRI, involves choosing and reinforcing a behavior that is physically impossible to do at the same time as the challenging behavior, example, reinforcing sitting in a chair while trying to decrease running around, reinforcing holding hands while trying to decrease hitting. DRO, A, reinforces the absence, DRA, B. Reinforces any alternative. DRL. D. Reinforces low rates. You reinforce a behavior that literally cannot happen at the same time as the problem behavior.